People ask about the first treatment, what they would expect. Initially, when somebody comes for the first time, we spend a considerable amount of time talking. In classical Oriental medicine, there are what are called 4 assessments to diagnose the pattern of imbalance. The most important one is asking questions about the condition that the patient is coming for, asking questions about what makes it better or worse, how long they've had it, what other treatments they've tried in the past. We also use the assessment of palpation. We take your pulse. It's a very important classical part of the diagnosis. We may palpate the abdomen, looking for areas of tenderness or discomfort that have clinical meaning. We palpate along the course of the channels and certain key points that are very diagnostic. We also use the assessments of listening and smelling. We listen to the quality of the voice. We listen to the tone of the voice. We listen to see if there's any crepitus or sounds that are made when the joints move. All these have specific meanings in classical diagnosis. Okay. And then finally, we use the diagnosis of observing. We look at the quality of the patient's spirit as reflected in their face and their eyes. We look for changes in skin texture, skin color. We look for changes in terms of the patient's complexion. And finally, we look at the tongue. The tongue is a very important diagnostic method. Patients fill out a form telling us about, again, their medical history, family history, etc. Using all that, we come to a diagnosis, which in traditional Asian medicine includes both what the disease is. Are you suffering from migraine headaches? Are you suffering from digestive disorders? Are you suffering from pain in the knee? And then the underlying pattern of imbalance that's causing that. Okay. The second part is treatment. Okay. And treatment consists of acupuncture and several what are known as ancillary techniques. Okay. Acupuncture, again, can be used. We have a variety of different size needles, different lengths, different thicknesses. Again, they all tend to be much thinner than your standard hypodermic needle. Okay. This is a standard 1-inch needle. For certain kinds of conditions, we might use a slightly longer needle if we want to insert a little bit more deeply. Okay. We sometimes use points in the ear, and for those, we have extremely small little needles. About a ½ inch long, and they just go right into the point in the ear, and these are extremely effective points for pain management. Okay. In addition, we have other techniques. We sometimes apply electrostimulation to the needles. This is essentially a modified TENS unit, and the leads go on acupuncture points. They go to needles that are inserted into acupuncture points. Again, we can use this for a variety of conditions. Very, very effective for pain control. Okay. We use cupping. Call for my assistant here. Cupping is the application of a suction cup. And again, we can put it on all kinds of parts of the body for a variety of conditions, but again, most usually for muscle pain. Okay. If she had a muscle spasm here, this cup would be pulling blood into the muscle tissue to nourish it and tonify and make that muscle want to let go and relax because of all the fresh blood that's been attracted to it. You can also use it in the case of excessive phlegm in the lungs, and the cups break this up. A lot of our patients have had this done to them by their grandmothers. A lot of European traditions of folk medicine include cupping. We also have moxibustion. Moxibustion is one of the oldest techniques of treatment in Oriental medicine. Moxibustion is Artemisia, Chinese mugwort, and it's a medicinal herb. There are many ways of doing moxa. My preferred method is what's called rice grain moxa, where we roll out, this is just the powdered leaves of the Artemisia plant, Chinese mugwort again, and we just take tiny little cones of it and place it on acupuncture points, and then light it with an incense stick and put it out just before it burns the skin. And it not only stimulates the point in the same way a needle would, but the actual herbal properties of the herb, Artemisia, have an extremely enhanced healing effect as well. This is particularly good for things like arthritis. It's good for digestive complaints to do some moxa on the abdomen. It's good to warm the whole body. There are points on the leg, on the ankle that are good for people who just can't get warm. They are always cold, particularly in the wintertime. And very, very powerful treatment for tonifying the immune system for people who get sick a lot in the winter. Okay. Oftentimes we'll use a piece of bamboo to put the moxa out. In addition to that, for some patients, if we want to continue the effects of the treatment when they go home, we use little seeds that are attached to a thin piece of adhesive tape and place them either on points on the ear or sometimes on the body itself. You've probably seen people, friends of yours who are trying to quit smoking, who have received acupuncture as part of the smoking treatment with a number of these placed in their ear. A very effective method of controlling craving for cigarettes. Okay. And then finally, for many of my patients, an herbal consult is part of the treatment. And Chinese herbs have been around for, again, 3,000, 4,000 years. Nobody's sure exactly when. They've been field tested in the sense that, you know, hundreds of thousands of people over 3,000 years have taken these herbs. We know what they're safe for. We know which ones work together. We know which ones don't like each other so much. So it's a very safe form of treatment. And herbs come in a number of different formats. Sometimes you can take them as pills. Sometimes you can take them as powders mixed in warm water. This is the oldest way, a bag of raw herbs. You cook them up on a day-to-day basis, you strain them, and you drink the resultant liquid. They don't taste good, but it's strong medicine that really has a very powerful effect on many conditions.